Breast Lumps Biopsy. Introduction. The breast contains glands responsible for making, storing, and delivering milk. Select true or false. Correct.
Breast biopsy is the most accurate way to determine if a breast lump is cancerous.
Select true or false.
Correct. Although examination and your personal history can be very helpful in determining if a lump might be cancerous, a breast biopsy is the only definitive procedure to make the diagnosis. There is one standard procedure for breast biopsy.
Select true or false.
Correct. There are many different biopsy procedures for breast cancer. You should discuss the one best suited for you with your surgeon. Are strokes and heart attacks common during and after this operation?
Select yes or no.
Correct. Anesthesia is now very safe. However, the older you are, and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as strokes and lung problems. Are infections very common after surgery?
Select yes or no.
Correct. Infections are very rare. Though rare, infections, seromas, as well as bleeding and scarring may occur. If you have had a biopsy, another biopsy may be needed.
Select true or false.
Correct. Another biopsy may be needed, particularly if the surgeon is not sure that he or she was able to get the targeted lump.
Thank you for using Explain.